All right. So tell me, do you think cans of cola should have the same kind of labeling as cigarette packets have now, saying that sugar kills? So this cola kills.
Shekhar, sugary drinks such as cans of cola are linked to tens of thousands of deaths worldwide, and in my view, they should be eliminated. In the ideal world, they should be eliminated from the food supply. So absolutely yes, there should be warnings like they have on cigarette packets now, maybe with a skull and crossbones on these sugary drinks. And I think parents of children should be particularly aware of this, that kids having these sugary drinks, even having juice, it's something that should be a very rare treat and not certainly part of their healthy diet.
Are you under threat?
I've had some. It's been a challenge when you're on a mission and you're on a campaign and you are exposing many truths that hurt the profits and interests of big business, and the sugar lobby is very powerful. Then of course that has had its challenges, but ultimately even as Gandhi said, even if you're a minority of one, the truth is the truth. And when people are given the information in a transparent way, I believe, Shekhar, everybody, ultimately, most people want to do the right thing. So it's about getting that information out there. And when you get it out there, then things shift. And ultimately, this is all about, it's a revolution. It's not just this book which we've written, it's not a weight loss book, even though people will lose weight. It's a book for health. But at the root of all of this is ultimately a revolution in health, so that in the next few years, for me personally as a doctor who's inspired by my patients and wants to see less suffering in the world, my greatest satisfaction will come in 5 years' time, if this is effective, that we start hearing that the type 2 diabetes and the heart disease levels and prevalence in India is going down, in England is going down, in America is going down. Because unless we do this, there's also an economic argument as well, Shekhar. We say health is wealth. It's actually true, because Morgan Stanley, the investment bank in the United States, they did an analysis and a report in 2015, and it's really quite shocking what they concluded. They said unless we get on top of the US's diabetes epidemic, so diabetes is a term that incorporates type 2 diabetes and obesity, by 2035 there will be 0% economic growth in the United States. That's how much of a concern there is. So they talk about, imagine healthier communities and and it's about lost productivity because of sickness, which is the ultimate problem.
Yeah. I just wanted to tell you, and maybe Aseem, you can tell them actually your background as a cardiologist, and so that they know they're talking to somebody who should know about all of this.
Yeah. So I've been, this takes, a lot of what's written is based upon my own clinical experience. So I've been a qualified doctor for almost 16 years. And I've been a cardiologist for 6 or 7 years of that, where I've been specializing in treating people with heart disease. And more specifically, I trained in something called interventional cardiology. So in layman's terms, it's basically doing keyhole heart surgery for people who have heart attacks. And several years ago, I had kind of a light bulb moment. In the summer of 2010, I was on call in the middle of the night. Patient comes in as an emergency, about 3 a.m. Man is middle-aged, and he was having an acute heart attack, and through keyhole, we unblocked his artery. There was a clot in one of his blood vessels, and it's a life-saving procedure. So the next morning, I'm doing my ward round to check on him, making sure he's on the right medications, etc. And also talking to him about a healthy lifestyle. He was a smoker. I had started off by telling him that stopping smoking was more powerful at stopping him coming in again with another heart attack or even dying than all of the cocktail of medications we're giving him combined, which he was pretty amazed at, which is actually true. I then started asking him or talking to him about following a healthy diet. Mm-hmm. And as I'm having this conversation with him, Shekhar, he gets served up by the hospital staff a burger and fries. And he looks at me and he says, "Doc, how do you expect me to change my lifestyle when you're serving me, if you pardon my language, the same crap that brought me in here in the first place?" And it made me think a little bit, because actually within hospitals, they're not a good food environment. And it's a little bit perverse. We're supposed to be setting a good example about what it means to be healthy in the middle of an obesity epidemic, yet 50% of the NHS, National Health Service employees, doctors and nurses, are themselves overweight or obese. And the food is not particularly palatable or healthy. So I started actually initially trying to sort of raise awareness, and I did this through a commentary piece I wrote, which got a lot of attention in the Observer newspaper, saying, that, I'm a cardiologist and, we're trying to combat this obesity epidemic, and yet you're serving junk food to my patients. So that's where it started for me. And then it became a process of discovery and research, actually going into how have we got to this situation where in the UK, Shekhar, 60% of adults are now overweight or obese, and 1 in 3 children, by the time they reach 11, are also in the same category. And the trends are only getting worse, they're not getting better. So this is where things started for me.
You talk about reversing, clogging arteries or reversing type 2 diabetes. But some of what you say in this book is kind of remarkable, that how quickly you can reverse it.
Yeah, I think it's a very interesting point because there's a problem with the current medical model. We are as doctors very good at diagnosing disease and then treating it with medications mostly. The reality is that a lot of these medications are not particularly effective. In fact, it's been estimated, according to one very senior researcher from the Cochrane collaboration, that prescribed medications are the 3rd most common cause of death after heart disease and cancer because of side effects. But that brings me on to, when you look at these chronic diseases we're trying to treat, whether it's high blood pressure or heart disease or type 2 diabetes, what I've learned and realized is that actually lifestyle changes are more effective than any drug at both preventing and treating these diseases than medication. Sorry, more effective than any drug, and come without side effects. If you look at type 2 diabetes, we were taught in medical school that this was a chronic, irreversible condition, and we treat it with medications as people's blood glucose goes up over time. But what the data now tells us, and I see this with my own patients, that if you cut out the refined carbohydrates and sugar, so I mean things like bread and pasta and rice, too much of this, and the sugar, people are reversing their type 2 diabetes, or at least coming off medications. I remember I just saw a patient very recently, Shekhar, who came to me, and he was quite emotional. And he'd come to see me, and he'd followed some of my work and some of what my colleagues are doing around the world, pioneering work, that some of the stuff that they're doing. And he decided, even though he'd been on insulin for 5 years and 4 blood pressure pills, he was going to change his diet. That's all he did, from cutting out these sugar and the refined carbs. And within a few months, he was able to come off all his insulin and come off 3 out of 4 of his blood pressure medications. Because actually, what's interesting is that the root cause that's driving heart disease and type 2 diabetes and to some degree high blood pressure and even cancer and dementia is something called insulin resistance. Essentially, the body becomes resistant to the effects of the hormone insulin over time. What are the factors that cause insulin resistance? Are the same factors you can treat through lifestyle changes. So it's about following a particular type of diet, which is a healthy diet, exercising, and that actually just means walking 30 minutes a day briskly for 5 days a week is very powerful for your health. Reducing stress, getting good sleep. These are the factors that are going to help treat many and prevent many of these chronic diseases. But the reason most people don't know about it, Shekhar, is there's no market. There's no market for this particular approach. And that's one of the reasons why we haven't combated this problem. So I think if people do these simple lifestyle changes, they will see the benefits very quickly.
Okay.